So this section will provide a review of strategies and outcomes, looking at each goal domain individually. So the first one was strengthening our relationships. So strategies being emphasized to support organizations to perform in this area was increasing the downtown eastside cultural competencies, sharing of best practices, maintaining engagement and momentum going forward, as well as improving and revising services based on feedback and the community's changing needs. So if you look at the chart here and you see all the specific outcomes that are being identified, you see one particular outcome that's clearly being emphasized, and so that's reducing care intensity required by clients over time. But you'll also see the other outcomes that are being prioritized here. So organizations have some flexibility regarding how to begin discussing those particular goal domain and aligning internal efforts and resources and strategies to help improve performance in these particular areas. Goal domain number 2 is extended care teams and competencies, so additional strategies to help organizations perform in this area, but also evaluate performance in this area. Includes the following strategies. So incorporating peer-based services across the continuum is applicable, sharing best practices across organizations, building shared competencies across the continuum so all providers are able to address the client needs, serving clients where they are, and enhancing awareness of available services. So if we look at the graph again, we see the same outcome clearly being prioritized in this domain as well. And you'll see the pattern change over the next couple of slides as different outcomes are prioritized within different goal domains. But this helps begin the discussion within and across organizations to begin implementing the healthcare plan. Goal number 3 is integrating services to provide better coordinated care. So the strategies to help perform in this area and also evaluate performance in this area identified was expanding integrated health services for women, but also establishing shared treatment continuum for housing, addictions and youth, expand the one-stop shop health centers. And that wasn't like in the true sense one-stop shop, but the idea is that there's additional services, that they're open extended hours, that referral and engagement and coordination could be supported through that model. Expanding mobile health services and developing a client database for tracking, reporting, and evaluating service models. So in this particular goal domain, which has a stronger healthcare emphasis, we see a lot of outcomes being strongly emphasized here. And so organizations, ultimately are being supported to implement all of the strategies in the report. But this graph provides a way to begin that conversation within and across organizations, recognizing that some outcomes, if we begin focusing there, we're going to have some of the greater impact based on the feedback provided from the community that informed the report. Goal domain number 4, so that's aligning services with client demand. So strategies that are being identified for this area to help with performance in this area, but also evaluating performance in this area. Repurposing available housing, low threshold methadone clinics, family service gaps, a managed alcohol pilot, food and nutrition programs, harm reduction and strategic planning, overdose training, and pain management practices. So implementing these programs or expanding on these programs, these service areas within the downtown east side. And again, with a stronger healthcare and program emphasis, we're seeing a lot of outcomes clearly being mentioned in this section of the plan. And so we see, between 5 or 6 outcomes that are particularly being emphasized, being referenced over 3 times. So the ones with the most emphasis includes increase at-risk downtown Eastside residents engaging in services, client-reported quality of life, overall health improvement, reduction in preventable emergency department visits and hospitalizations, and an improved impact of treatment of chronic diseases, mental health and addictions, HIV, and hepatitis C. But we also have some additional outcomes that do need to be emphasized as these strategies are rolled out throughout the downtown east side. The last goal domain mentioned is achieving performance excellence. So this is more of a data-driven or administrative goal. Strategies include client focus groups and consultations, feedback used to evaluate and improve service models, develop service definitions to align best practices and goals, and developing outcome measures to evaluate progress. So on this slide, this chart, we'll see the outcomes that are being identified for this particular goal domain and how often they're mentioned. And we'll see on the far hand right side a pattern that we've seen earlier in this discussion is an outcome that's clearly being prioritized, so reducing care intensity required by a client over time. So again, that represents a useful area for organizations to consider beginning the dialogue and realigning internal processes, practices, services, and care coordination to begin implementing some of the strategies in this particular goal domain, followed by implementation of the remaining strategies and focusing on the outcomes that are also mentioned in this section of the report.